Good afternoon, everyone, and welcome to the Landmark College webcast about health and counseling services here at Landmark College, partnering with you for your health. My name is Chris Lenois. I'm the Director of Marketing and Communications here at Landmark College, and I'll be moderating today's session. Joining me as panelists is Jeff Huyett, who's our Director of Health Services, and Jackie Mills, our Director of Counseling and Wellness. If you have not been on this platform before, I want to direct you to the button that allows you to ask questions. We encourage you to ask questions at any time they occur to you during the presentation. Jeff and Jackie are going to give about a 45-minute slide presentation, but if you have questions about particular things, I will stop them in the middle of their presentation and have those questions addressed at that time. Other questions, if they occur to you, we have allowed time at the end to take those questions as well. So please, by all means, use the ask a question button and get it in the queue, and we'll make sure it gets answered. One, I'll also mention that this event is being recorded, so if for some reason you're unable to stay the whole time, we will be keeping an archive recording of it and making it available later on. Just before we start the formal presentation, because this is all about health and wellness in general, but a lot of you out there probably have questions around the coronavirus pandemic, and that certainly will be addressed by Jeff and Jackie. I wanted to play a video for you. It was actually created by one of our students who was an intern in the Marketing and Communications Department last semester. His name is Gabriel Raphael, and Gabriel made this video about the measures we've taken here on campus to try and prevent and mitigate the spread of COVID-19. So it's a video about 3 minutes long, and I'm going to play it for you right now. Hope you all enjoyed that presentation. Certainly was great to have students on campus in the fall, and we're looking forward to welcoming back this spring with the same and some adjustments to those COVID safety protocols in place. And that will be something that Jeff and Jackie can certainly answer questions about as we go through this presentation. So why don't we kick things off? Jeff and Jackie, please take it away.
Hey, good afternoon, everybody. Let me pull the slides up here. All right, so I'm Jeff Huyett, and I'm a nurse practitioner, and I'm the Director of Health Services. And Jackie is here with us. So health and counseling are two co-housed offices. We share a waiting room, and we collaborate together pretty readily. On the Landmark website, if you go under Student Affairs and get onto the Health, Counseling, and Wellness page, there's a great guide on there about transitioning your medical and mental health care to Landmark, and I encourage you to take a look at that. It helps you to plan ahead if you're somebody who has chronic conditions or if you're taking medications, and gives you some guidance. We'll talk a little bit more about what we can offer you as far as help with students who are on meds or need consultation. The health center and counseling centers are on the second floor of the student center, so we're readily accessible. We're on the lower campus. Health services consists of myself, Bridget Shea-Gander. She's in the center of this slide. Bridget's a nurse practitioner, pediatric nurse practitioner who we hired to be with us for the year. Because we're expecting to be busier with COVID this semester, and Dawn Kenny, who's a registered nurse clinician. And I'll let Jackie introduce her staff.
Hi, my name is Jackie Mills, and as introduced earlier, I'm the Director of Counseling and Wellness. And this is me and my staff. So I have 4 full-time counselors. The first person to my right is Janine Bedard. And then we have Meg Spicer. Meg Spicer is also our sexual respect coordinator. Next to her is Tori Tilson, and Tori is about all things wellness. And lastly is Matt Cherry, and Matt Cherry is our addiction specialist. So that's my team.
And this is Cindy Brown. Cindy is our office coordinator, and she's the nerve center of our offices. So she's our tech expert, and she's the person you call and talk to set up appointments and get in to see us all. Jackie's going to talk a little bit about how to set up counseling here on campus.
So we've tried to make counseling really accessible. So if you go to the home page on SharpNet, which all students, once they're enrolled, can do, there's actually a link. You don't even have to click around. There's just a link that says request counseling. And you click that, and it's going to ask you a few questions, and you will submit that form, and then a counselor will actually reach out to you. We will take a look at your schedule to make sure that we're offering you an appointment that isn't competing with a class that you have. And we usually schedule appointments about 2.5 days after we receive the request. For students who may be having an event on a particular day, a mental health event, we do have urgent appointments available to students. And in addition, my staff provide 24-hour backup to our residential life staff. So if there is a crisis or emergency after hours, there is counseling consultation available on campus.
And I should mention that, getting a lot of feedback. I should mention that we also work with a consulting psychiatrist who does telepsychiatry. All of the services through health and counseling are a part of the tuition package. So we don't bill out for our services. Students are able to get counseling weekly if that's what they'd like to do. And we'll talk a little bit more about the details of the services that health services offer. Our psychiatric consultations are fee for service, so that's not a part of the usual tuition package. And so it's a fee for service model, and then you can submit claims to your insurance to get reimbursed for those services. The mission of health services is basically to support a healthy lifestyle and help keep our students well so they become, can stay academically successful. Health services and counseling services are governed by HIPAA laws, which are the legislation that protects privacy in healthcare situations. So for when you have a student here on campus, if you're a parent and your student who's over 18 wants to have you access their academic records, they can have you sign what's called a FERPA, which is a release around educational records. But that FERPA release doesn't cover healthcare information. So all the stuff that happens in health and counseling is between the client and us. So unless the student agrees to have us share information with other people on campus, it's confidential, just like when you go get healthcare at any other office. And I want to point out too that and we'll talk a little bit more about this later, the health and counseling staff are not a part of the formal reporting system on campus. So when students come to us with an issue around, say, sexual violence or assault or addictions, we're not reporting that information into our reporting system on campus, so that we're not a part of the usual reporting chain. So it's a place where if a student wants help working out a situation, we're going to work that out with them, and we're only going to talk with folks on campus if they want to have us talk with them.
Jeff, can I just pop in here and add something, which is that there is an exception to that rule, which is if we are concerned about a student's safety, we will share that information. We'll ask permission of the student first, but that is the one exception to the confidentiality requirements. The other thing, related to what Jeff was saying, is that the health and counseling records will never become part of your educational record. They are separate, and they would be released separately if you contacted the college and said, I've started with a new counselor and I'd like to have my counseling records sent to my new counselor. And then we'll walk you through what that looks like to do that. Sorry, Jeff, that was just...
Great. Feel free to jump in. I put this slide in we're a small campus. We all eat in the same dining hall when we get to eat in the dining hall. And so we just encourage students, email us, give us a call, make an appointment. We love to chat you up on campus, but we don't want to talk about your health issues when other folks are around. So we encourage students to help keep their care private. So the types of care that we provide in health services, so we're like your general primary care provider. So, if you have questions about, say, weight, or you want to quit smoking, or you're having a rash, all the usual things that you would make an appointment to go see a clinician about, those are things that we can handle. We don't have any problem when things feel out of our scope of practice to refer on to specialists. But both of us are fairly seasoned nurse practitioners, so a lot of the care that we provide here we're able to handle on our own. And I'll let Jackie talk a little bit about the kind of counseling services we have.
So as Jeff talked about earlier, we provide mental health services. Our first and primary role on campus is to provide clinical services to our students. We see about 60% of the entire student body every academic year. So counseling is a pretty normed activity at Landmark. Some students we might see once or twice, and some students we might see, for 15 visits over the course of the semester. And I referred to some of the other kinds of clinical services in terms of urgent and on-call backup. The counseling department is also really engaged in providing consultation and education and outreach kind of across the campus. And we frequently partner with health services to do that. We offer brown bag presentations for faculty and staff so they can be involved in supporting your wellness in addition to our two services.
And I'm seeing a question from Lauren, and she's asking, where's the closest hospital? So Putney is about 10 minutes north of Brattleboro, and Brattleboro has the Brattleboro Memorial Hospital. We tend to use that emergency room when we need emergency room care. A lot of they have a limited number of specialist consultants. So some students will use Cheshire Medical in Keene, which is just another 15 minutes away. So it's about 25 minutes away for specialty consultations. Jackie mentioned we're involved with health education, both individually. We also do programs on campus, might be around diet. I used to do an event weekly called Healthy Table, where students could sit down and we could eat lunch together, talk about the foods we're eating and how to make healthy choices with food. We also do a lot of prevention work. We offer flu clinics. We work with our resident assistant and resident deans staff to look at what are some of the prevention kind of teaching that would be helpful for students. So sometimes they might identify that students are in their room gaming too much. So maybe offering some presentation or some work around, how to get out of your room, how to get off your console and participate with folks face to face. We also do procedures and treatments in health services. So young people tend to have problems with earwax, and so we do a lot of flushing of earwax out of ears. And I've worked as a surgeon, so I do minor office surgeries. When we get folks with lacerations, I can sew those up in the office. We do general women's health care as well. So about 60% of our students are on medications of some kind. So we have a high number of students who have ADD, so they're on stimulants. For some students, it's not practical to work with a provider that's outside of the state. And so I work with a lot of students around managing their medications. And then I'll work with the consulting psychiatrist if a student needs a better diagnostic evaluation around starting medications for mental health issues.
Jeff, do you see that other question here?
Yeah, so
Okay.
There's a question from Dylan. If students have a specialty appointment, how do they get to Keene? So we have a couple of car services that we use. We have a cab service that can go to Keene, and then we have a former alumni who has a car service that he runs like a kind of like a Lyft service or an Uber service. And so we can book those ahead of time. Depending on the timing of when people go, when we start doing shuttles, so our shuttle service to Keene and Brattleboro has been somewhat curtailed because of the pandemic, but we usually have frequent shuttles that go both to Keene and to Brattleboro. So it's possible that we can, if students need to get set up at Cheshire Medical in Keene, we can use the shuttle drivers to take them to their appointments too. So we can work that out. Also, a number of students on campus have cars. So as folks get familiar with other students, inquiring too if like a friend can drop you off in Keene for your visit.
Jeff, I just added a link to our transportation and shuttle services page for people to review as well.
Great, thank you. So Jackie and I sit on our crisis team. So our crisis intervention team has upper administrators seated on that. And then Jackie and I have been on that team throughout the pandemic to offer our consultation and advice. and then because I'm a nurse practitioner, I'm sort of the health official on campus. So I'm the person that is in contact with our health department. I'm meeting weekly with our health department right now. All the Vermont school health services meet weekly with the commissioner and assistant deputy commissioner of health here in Vermont. So we're in constant contact regular contact with them. So we're up to speed with the information about what's going on with the pandemic. So before I go on, there's a question. If a student is prescribed a medication that is classified as a controlled substance, how is that stored and administered? So both Bridget and I are prescribers. We have full prescribing license here in Vermont, so we're able to prescribe controlled substances. So students, because medication taking is really common on our campus, we tend not to have many issues with students having medication stolen or taken out of bags. But we encourage students, if you're worried, bring a lockbox that you can keep in your room. We don't administer medications to students on a daily basis. So students need to come ready to manage their own meds, take their meds when they need to. We'll work with them if they have trouble with, keeping on a schedule, and come up with some practical guidance about how to manage their meds, and can work with them around that. So I wanted to talk a little bit about, common features of college-age students. So for many of your students, coming to college might be one of the first times they've been away from home for an extended period of time. So students begin to get their wings, as it were, and learn how to be more independent. It's a time, we know, for young people that they start exploring how to make friends, how to date. Also, it's a time where students are exploring, drinking alcohol or experimenting with drugs. And so we know those are common attributes of college students, and it's something that we're ready to deal with. And what can happen with that independence? So sometimes for students, they're a little bit at loss because a parent may have been working with them really closely around medication taking or around getting regular healthcare visits. And so sometimes we'll see students somewhat fall off the map if the parent isn't involved and trying to give them some space. The student might need a little bit of outreach to get in and get some care. What we like to do in health services is keep tabs on students that we know take medications. We tend to follow students' attendance in class and monitoring their grades, monitoring conduct reports, so that we're keeping an eye out for when some of those things like too much independence or maybe too much experimenting with drinking, when those things are impacting on their academics or in their social life, we reach out to students and try to ring them in to get some care to deal with those things. We do see a number of maladaptive coping on campus. And like I said, what we like to keep an eye out for that. We work, we're a small campus. There's about 150 employees. When the dining hall's open, most of us are eating together most days. So we're in pretty regular contact with advisors on campus, faculty. And so oftentimes the people that are seeing your students every weekday in classes or in their residence halls, they're calling us up to say like, hey, I'm noticing, this student seems to be, kind of hiding out in their room and they're not making it to class. I'm wondering if you might reach out to them, and we'll do that the other direction too. Like if we want to have an advisor help us to get a student in to get evaluated, we can reach out to them. We don't share health information with advisors or with resident deans unless it's an issue of imminent safety concern. But we do we do work with them like when we're needing help to outreach the students. Jackie's now going to talk a little bit about an interesting survey that we did a couple years ago called the Healthy Minds Survey through the JED Institute.
So we had a really wonderful opportunity to work with the JET Institute. And as part of that work, we participated in a Healthy Minds survey, which is a national survey. And it allowed us to compare our campus and our students' experience against other college campuses. I think one of the most striking things, and we kind of knew it anecdotally, but one of the most striking things that came out of that survey is that 57% of our students report having been diagnosed with anxiety at some point in their lives. So anxiety is kind of a big theme on campus. And it's, again, kind of going back to our educational role, one of the reasons that Jeff and I work a lot with RDs and with faculty and advisors is when you look at those numbers, that anxiety is going to show up in all kinds of places. So the more professional staff on campus who have some tools in their toolbox for helping our students with anxiety, the better. So the other thing that our students tell us is that their anxiety, and there's actually even more recent data coming out nationally about kind of the anxiety that is occurring with COVID and isolation. But 31% of our students say that it really affects them 3 to 5 days a week. And 22% of our students say that they feel some impairment from their anxiety for 6 or more days. So those are big numbers. And so as a campus, we kind of take a public health approach to dealing with anxiety, just like we take a public health approach to dealing with COVID. And some of the concepts that you'll hear when you're on campus and that I think are pretty common across faculty and staff groups is that we really understand that amygdala activation is the fuel for all anxiety. And the amygdala is that part of the brain that kind of gets revved up. It's the fear, fight, flight, freeze response. And so there are a lot of strategies built into the curriculum and into people's toolboxes because we know there's 3 buckets for how we can help our students work with their anxiety. In the first bucket are what are those things that are immediately effective? And those are things like diaphragmatic breathing. It's called a whole bunch of different names, but it just means really breathing deeply and things like, aerobic exercise. You might see a student walking around the quad really, really fast. And what they may be doing is trying to manage their kind of immediate anxiety symptoms. We also know that yoga can be effective because that's really, really combines breathing with movement. And one of our goals is to help students understand that there are things in that second bucket. There are things you can do in an ongoing day-to-day way that will actually help your amygdala be more relaxed. So it's not humming at, 1,000 miles an hour. Maybe it's just humming at 20 miles per hour. And we know that things that are really important are regularly scheduled aerobic exercise. And there's a lot of discussion going on campus with that. Todd Miller is a big proponent of exercise and can help you with that. There's a big emphasis on routine and adequate sleep. And as Jeff referred to earlier, balanced diet, watching that Red Bull and caffeine use. We really encourage and support people to consider some mindfulness practices. And again, going back to the webpage, the home webpage, making it really easy again, there's a link that helps our students figure out what are all those apps out there and which ones, cost money and which ones are free. And so we really try to help students deal with that. And then we don't really have a slide for this, but part of the work across campus, but also in counseling, are kind of the long-term interventions, which are really things like counseling and exposure. We have an expression about you can't avoid anxiety, that it's there. How can you learn to increase your tolerance for anxiety and to push through anxiety, which will actually rewire your brain. So our students are getting incredibly anxious about tests. There's a lot of ways that we expose them, practice tests and tests in groups and those kinds of things. Again, can't avoid taking a test, but through exposure and a willingness on the student's part to really persist, you can kind of change that wiring in the brain that creates so much anxiety.
And we'll talk a little bit more about how we like to plan with students when they're here on campus in a minute. So generally speaking, our dining hall is, depending on the food plan you have, if you're eating in the dining hall, it's an amazing food. When the dining hall is fully open, there's a huge selection. And you know how they say that the freshman 15, I joke that here at Landmark, it's often the freshman 30 because the food is really good. And students have, remember I said they're experiencing being on their own and not having a parent oversee what they eat. And so it's pretty common to see students put on weight. And so we try to keep on top of that. Our dining hall staff is really great at helping students to make food selections. So they're there to answer questions if students want some help about making the right food choices so they're not packing on those pounds. I talk a lot with students about sugar and sugar intakes. This is just a photo that just shows the amount of sugar that's in some common beverages that folks drink. We know that sugar is psychoactive. We know that for students with mood disorders or mood instability, that their sugar intake is going to impact their mood and their responses. And so I talk a lot with students about how to avoid sugar and look at more healthy beverages to be drinking. This is just one of the walking maps we have on campus. So this is just the quad, the main campus, but Landmark's about 150 acres. And besides these walking paths that we have right on the immediate campus, we also have hiking trails. We have a ropes course and a zip line that our physical education and our activities folks periodically use. So marijuana is legal in Vermont. And so people who are over 21 can possess and use marijuana. But Landmark is a federally funded school, so we do get federal funding. So it's not legal to use marijuana on campus. And so we do talk with students about, it's important, even though weed is legal here in Vermont, you can't smoke here on campus. We talk, alcohol is something that obviously is readily available if you're over 21. And this is something that we see a lot of students, experimenting, exploring with. One of the things we like to really impress upon students, and especially for students with learning differences, our brains aren't fully formed until age 25. So, things like alcohol and drug use can really affect those final few years of your brain development. And now Jackie's going to talk a little bit about our amnesty policy here on campus.
So one of the 4 kind of core principles, they're called RUSH. If you end up being a student at Landmark, you'll learn all about them. But one of those 4 components, the S of RUSH, is really about safety. And so for that reason, we have a medical amnesty policy on campus. And what it does is that it really provides protection from disciplinary action when somebody calls for help. Let's say you aren't really good about judging how much you drink and you drink way too much and you're sick and your roommate knows you're sick and they're worried about you, but they don't want to get you in trouble. We want all of our students to know that we have this policy. So it applies to both the student who's reporting the incident. So I'm your roommate and I see that you're way too drunk. And I called in order to get help. And again, we don't want to see anything that gets in the way of our students being safe. So there's a fair amount of education about this policy. You won't be punished for helping a friend. The most important thing that students can do for themselves and for each other is to get help. Having said that, it's not like something that the amnesty policy isn't something that you can use every week without at some point our director of conduct noticing that and having a conversation, because that's not the purpose of the policy. It's really about supporting students getting help.
Thanks, Jackie. So, Vermont gets cold in the winter, and our students come from all over the country and various foreign countries. So we always like to remind folks, get the right clothes when you come here. So have winter boots and winter shoes and hats and mittens and gloves. See Bernie Sanders' pictures from the inauguration. That's how we dress here. Typically on our campus, flu is a common condition. So far, we've seen only one case of flu since October, so that's really great. We do flu vaccinations on campus. We've already done rounds of flu vaccination already. So unless we get a lot of requests, we probably won't be offering those this spring. But with masking and social distancing, we're not seeing the level of flu that we typically see. So we encourage students, to this time of year to really take measures to prevent getting sick. And so all the things we're doing for COVID are really helping in the prevention of flu. When students do get the flu, we do have a quarantine process that we set up for students with the flu. So when the pandemic happened, we already had practices in place to pull students out of congregate living situations. So we have a specific house that we used to use for flu quarantining. And so now we're using that for COVID isolation. But I have 2 suites in one of our buildings that I'm setting aside this year. So when students are sick, that we can pull them out of the community so that they're not at risk for transmitting virus in their classroom or living setting. On the outward-facing landmark page have a lot of the details of what our COVID response has been. And if you have specific questions, we can talk about those further. But the basics of Vermont requires that students get tested at day 0 when they get here, and then we test them again in a week. So we have them do a week-long quarantine until they've tested twice negative. Right now, we're waiting on our first rounds of tests for our group of students that came back last night. And then our classrooms are set up with adequate spacing. We have small classes anyway, so the number of students in classes tends to be smaller than most colleges. And so we've reduced that even further during the pandemic so that we can keep students at a little more distance than typical. I mentioned earlier that the health and counseling staff are available when someone has an icky sexual experience. And like I mentioned, we're not part of the reporting system. And so if a student, say a sexual assault has occurred and a student's not sure they want to go to the police or they're not sure they want to talk to campus administrators about it, they can come in and talk with health and counseling staff to tease out what's the next action, what's the plan of care. And again, we don't report those things. So that stays in our office until the student decides that they want to activate any external resources outside of our office. And we offer, as I mentioned, students are experimenting with dating, with sex. And so we offer workshops on campus about, how to get affirmative consent. We've been having a dating boot camp for our peers program. So the peers program is something that's offered through our social pragmatics program, where it's a place where students can learn some of the basics of how do you express you're interested in someone, what are the first steps to doing that? Because we realize that for students who might say be on the autism spectrum, it might not have been something they've approached. And so we've got some services in working with social pragmatics about how to approach dating and consent and negotiation. Off hours, so when we're not open, so we're open Monday through Friday, basically 9 to 5 roughly. And when we're not here, campus safety and the resident deans are our eyes and ears. So when something comes up, they're able to talk with our 24-hour counseling on call service or check in with me. But we also have a nurse triage, telephone triage service. So students have access to that number when health services is closed so that they can call and get a consultation with a nurse to decide if it's something that needs to be dealt with right away or can wait till the next time that health services is open. So Vermont is one of the whitest states in the country, and we recognize that. Our staff is predominantly white. There are not a ton of people of color on campus. So one of the things that our campus has devised is our Centers for Diversity and Inclusion. We have 3 centers. The Rise Up Center, which is focused primarily around race and class. I encourage students of color to get involved with the Rise Up Center. It's a place where you can develop some affinities that you might not get otherwise, in the sense of, Vermont being pretty white. And so it's a place where people can kind of explore, what it's like coming as a person of color to this really white state, especially if they're coming from urban areas where they're used to having lots of people that look like them. The Stonewall Center is geared for LGBTQ people. And the Center for Women and Gender is focused on women and gender issues. And then Jackie's going to tell us a little bit about some other programs that sort of interrelate around wellness on campus.
Oh, I didn't know I was doing that. All right. So, we are a small campus, and there is wellness as part of our strategic plan. And so, again, it's not just Jeff and I and our teams that are focused on wellness. So the Click Family Sports Center offers a lot of wellness opportunities, everything from, what's that kind of dancing, Zumba classes to rock climbing hours, weekend activities. Also, the Drake Center for Academic Support is a place where students can go specifically to get support for their academics from professional staff. Your academic advisor is a person who, particularly in our first year programs, the academic advisor meets with students every week, and they can help direct you to services or supports that might be unique to you. You can also tap into executive functioning coaching if executive functioning is a challenge for you. And our library is amazing. They're amazing with students, but they're also amazing with faculty and staff. And they have all kinds of ways that they can support and help you. And also our educational technology department.
Thanks, Becky.
Yeah, it's okay.
I was supposed to go over that slide, sorry.
First time we're doing this. This is great.
And, for students, that need a little more technology assistance, we encourage them, to think about an app on their phone. So apps like Know Your Meds, or that can give you reminders to take your meds. If you're wanting to look at your fitness levels, MyFitnessPal is offered through our dining services so that you can look at calorie counts on there and your steps. There's a question from Lauren, and she asked that we mentioned Matt, who is one of our addiction specialists, and asked, does the counselor interact with students proactively? What is their role? So the counseling staff doesn't get a lot of information about students ahead of their arrival, but health services does. So health services has a number of mandated forms that we'd like you to fill out that tell us about your health history, the medications you're on, your vaccinations, and that kind of stuff. So just today, we went the nurses and I went through all of our new students that are coming this semester and looking at those students who are on medications or have related that they have an addictions history. And what we'll do is we do outreach before students get here. So we've been doing that since students started to register here at Landmark. And we'll give them sort of a tour of the services like we've been doing today and direct them into some appropriate services if we feel like that would be beneficial for them. One of the things I like to do is encourage students to come up with a wellness plan. And so for students who feel like it's something that they haven't paid a lot of attention to, I encourage them to think about what are the needs they have to stay well while they're here in campus and come up with a plan of their own. So to think about what challenges they have, what goals they have around their body, the way they look, the way they feel, and what can they do to sort of make some healthy changes and lifestyle changes. And then I just give them like, here's my wellness plan, like here's what I've made a plan to do either each day or each week, and have them literally write it out on paper so that they can stick with their plan. And then one of the other things that we offer on campus that's a campus-wide tool is the distress tolerance plan. And Jackie will tell us a little bit about that.
So you're going to have good days at Landmark, and you're going to have some probably challenging things that come up for you. So if you're a person who, particularly when they get distressed, it shows up in ways that make you feel uncomfortable, like, I wish I hadn't done that, or I wish I hadn't burst into tears or throw myself on the floor. One of the things we really encourage students to do is to develop a distress tolerance plan. And that is really to have students think about and preview what are some of the signs and symptoms and behaviors that indicate you're getting distressed. And that part of that is about self-awareness, and that's one of the things that we really want all of our students to learn to do. The other thing is to really identify what are some things you can do that will relieve stress in the moment, just to help you regain your balance and calm yourself. Because when you're in the middle of a stress event, you aren't doing your best thinking. That your prefrontal cortex is not available to you. And so kind of pre-planning, what are some things you can do? What are the things that you do that help you calm down or feel more at peace? And then also to identify, there are a ton of resources at Landmark. And you come to Landmark with a ton of resources. And that could be family or friends, friends at home, counselor at home, a counselor. But a way to remember that you have resources. Those resources might not be available to you in the moment you're feeling bad. They aren't on-demand resources, but they are there for you. And it's important to remember that. So many of our students kind of proactively develop their distress tolerance plan, and the advisors are familiar with this plan, the RDs are familiar with this plan, health services, counseling, and from the feedback we've gotten from students, it's been really helpful for them. It helps them feel like they are able to manage whatever comes at them, including their own distress. Yep.
Yeah, so a lot of students will literally fold their distress tolerance plan up and put it with their ID. So folks on campus know to say, like, do you have a distress tolerance plan? Let's look at it together. And then just lastly, just a reminder again that on the Landmark webpage, not SharkNet, well, you can get it on either page, but on the outward-facing Landmark website, under Health, Wellness, and Counseling, you can look at our transition guide that helps you think about the things that you need to get rolling and get in place before you come to Landmark. And we'll open it up if you all have other questions for us.
Yeah, thank you, Jeff, and thank you, Jackie. Great presentation, and you did a great job of answering questions as they were coming in. So there are currently not any questions in queue, but we do have time if people have a couple more questions that they want to ask about health and wellness here at Landmark College. I actually have a couple that I just want to have you fill in a couple blanks on, both of you. Jeff, you had mentioned our policies on marijuana use and alcohol use, but what about tobacco use? You mentioned tobacco cessation, but I don't think we're a tobacco-free campus. Is that right?
Yeah, that's a really great question. Yeah, we're not a tobacco-free campus. It's something that we've discussed. And what we've done so far is we call them the butt huts. So for students who are smokers or vapors, we have designated spots on campus where they can go and smoke.
Yeah, I just wanted you to say butt hut on a recording. That's why I fed you that question. It's captured in perpetuity now. And Jackie, you were talking about stress relievers and things like that. And I know this isn't necessarily under the counseling office, but I know you can talk a little bit about the therapy dogs here on campus, which is certainly something that a lot of people take comfort with.
Absolutely. So I'm trying to remember at last count, there are a number of therapy dogs on campus, and each dog kind of has its own personality and its own role. But Snickers was the grandfather of all the therapy dogs, and he is a chocolate lab who's incredibly sweet. And students really find a lot of comfort in scheduling times to meet with the therapy dogs or kind of casually running into them. We hear a lot about how much students miss their pets at home. And so the therapy dogs are there. I think there's 5 or 6 right now.
I think there's actually a couple more than that. I think at one point we had 9, but with Snickers retirement, I think it's 8 now, but it's hard to keep track.
And Riley, who's actually one of my dogs, who's a therapy dog in training, has to be retrained kind of post-COVID because he's been pretty hunkered down and he's a young dog. But yep, we do have the therapy dogs.
And therapy dogs are a little bit different than comfort or like comfort animals, support animals, emotional support animals, which are also permitted here on campus. Yes.
Yes. There is a process for getting. You need to get authorization if you're considering bringing a support animal on campus. It's a really, I think it requires a lot of thought. How much time and energy do you have and what does your animal need? But requests for comfort animals can be made through disability services. The therapy dogs are primarily dogs that are owned by faculty and staff who have some basic manner training and are really just there to be a warm, fuzzy, loving face for our students.
Yeah, great. All this information and more available on the landmark.edu website. And here we go. A question just coming in about the dogs. With COVID-19, are we concerned at all? Is it safe to pet the dogs, or because I think I know that there's been documents of spread from humans to cats. Is that right? But what about dogs?
Yeah, no, and actually during COVID, you would have to schedule. Sometimes the the therapy dogs are out and about on campus, and prior to COVID, students could come up and ask permission, to engage with the pet. But since COVID, different owners have put in different protocols, and like I said, for my dog, there's a lot less dogs on campus. Partly because putting all that sanitizer on your hands and then touching the dog is not very appealing from the dog's standpoint because there's a lot of alcohol and scents in those. And because we just haven't known for sure, can animals carry it on their coats and those kinds of things. So the therapy program is there, and I would imagine in the spring we'll be making some recommendations about how to make sure it is a safe program. But it's definitely different than it had been pre-COVID.
Right.
Like everything.
Everything's a little bit different, indeed. But we've been managing it well so far, and hopefully we'll continue to do so in the spring. It certainly takes the cooperation of everybody here on campus and the families at home for doing that. We are out of questions, and we are almost out of time. So I think we will close this session. I really want to thank Jeff and Jackie for joining us today and sharing this information. And again, reminding everybody that this will be available as a recording. And that did give time for somebody to ask a question. So we will take this question. Thank you. What resources are available for me as a parent, if any, that I can review to prepare my son about moving and traveling on his own? You probably both have something to say about that.
Yeah, so our housing staff, our residential life staff, when students start to make applications for residing on campus, there are a number of questions they ask about personality type, what you're looking for in a roommate, what are some of the needs you have to be housed with someone, and they'll be looking into like assisting you with making travel plans. We have shuttles that go to Boston, to the airport, and to Hartford, to Bradley, so that if students are flying here, we do have services to pick them up and bring them to campus.
Jackie, you want to add anything about resources?
Yeah, I think that, I think having a conversation with your student, helping them preview kind of what are all the steps and tasks, asking them which ones do they feel really confident in, which ones are they not so confident in. Even our drop off and pickup is very different with COVID. We have what's called a touchless drop off, which is even parents who are driving their students to campus will not be able to go into the dorm and help their student set up their room. And for that reason, the RD staff and the RA staff have made all kinds of fun videos about what a room looks like, how different students set it up. So students know before they come, they can kind of preview those. You can help the students say, okay, what's the best way to organize your desk and those kinds of things. So I think really knowing, as a parent, you know your student better than anybody, and knowing what are going to be the pinch points for them, either in traveling alone or in settling in, and helping them do some problem solving, and also referring them to those resources on campus that are specifically there for them. These services, they're great, but if your student doesn't access them, it's not all that useful. So RDs are an incredible resource for students. So when our students deposit and they filled out those forms about what kind of roommate, and they're assigned a room, there is an RD that's associated with that building that can be a great point person for you as a parent as well as for the student.
I wanted to mention to you all, if you have other questions, you can email healthservices@landmark.edu. So that's healthservices@landmark.edu. So if you have other questions while you're considering if Landmark is right for you and your student, and health-related concerns that might be, affecting that decision, feel free to email us and we can answer those for you. And if we can't answer it, we'll definitely direct you to the correct person to answer those questions.
Yeah, thank you for giving that address, Jeff. And definitely that's the advantage of being on a small campus like this is if you can't answer it immediately, we can certainly get you in touch with somebody who can answer things pretty quickly for you. Mentioning what Jackie was saying about the resident deans, last Thursday, our webcast on this platform was with the student life team, which included some of the resident deans, and they talked a little bit about that dynamic there. So I encourage people to go back and watch the replay of that. Thank you, everybody, for joining us today, and thank you for the questions. We will be back next Thursday at 6:30 p.m. Eastern, and the subject of that webcast will be hybrid learning, so people looking for options of online and on campus. So hopefully you'll be able to join us for that. Have a great evening, everybody.
Bye.